My name is Sally Lyles, and I am going to perform my musculoskeletal and neurovascular check today. And first, like all assessments, we're going to start out with inspection, and then palpation and auscultation if we need it, but we don't need to on this one. So the first thing I am going to do is palpate for my radial and brachial pulse on my patient. And so the radial pulse is by the wrist. And his is strong. And brachial pulse is in the bend of the arm. And it is strong and normal. Next, I'm going to test the muscle strength of his hands. So squeeze my hands real tight, both sides. Keep squeezing. Okay. And those are, strength is strong and equal bilaterally. Next, I'm going to check the range of motion of his hands. So I'm just going to have you stick out your hand and then bend your hand and go back out and do each one of your fingers. Okay. And then while I'm doing this, I'm also just going to, while he's doing this, palpate the joints and assess for any pain, tenderness, or crepitness. And do you have any pain or tenderness in your joints? No? Okay. And then also his range of motion on his hands is good and doesn't have any issue there. Next, I'm going to check the range of motion of his arms, and then I'm always going to place my hand under the joint that I'm assessing to make sure that I don't feel any clicking or anything like that. And there always will be some clicking in people, and that's normal. So, okay, so what I want you to do is stick out your arms and go up and down, okay? And then raise them up over your head. Okay, and then go back down. Okay, and then next I'm going to do the range of motion of his shoulders, and I'm going to have you stand up for this. And what I want you to do with your shoulders is just go back with your arms towards your back. Okay, that's good. I don't feel anything. And then now I want you to put all your hands up over your head. Okay, and you put your arms down. And next I want you to put your arms behind your head. And then do you have any tenderness or pain in your joints while you do that? Okay. I also don't feel any crepitus in his joints. Okay, so then I can have you go ahead and lay down now. I'm going to next inspect the symmetry and skin characteristics of his lower legs, and also look for the hair distribution and any varicose veins. And I do not see any varicose veins on him. His hair distribution is all the way down, and his legs are not shiny. And I also note that the skin color is the same throughout his legs. So next I'm going to assess his popliteal pulse just behind his knee. And I can feel that. And then I'm going to feel the posteriotibial pulse, which is just behind his ankle here. And that's strong. And next I'm going to do the dorsalis pedis pulse, which is just on top of your foot. I can feel it right there, and it's strong and beating normally. Okay, so next I'm going to assess the range of motion for your feet, and I just need you to push up towards the ceiling. Okay, and then go down. And then move your ankle side to side. Okay, do you have any, push down on my hands? Okay, pull up. Have any pain or tenderness in your joints?
No.
No? Okay. And then next I would like for you to stand up again. I'm going to assess for his hip range of motion, and what I want you to do is go side to side with your hips. Okay, and then twist. And then I also want you to bend down and touch your toes. Okay, and then while you're doing this, you can also assess their spine to see if for any scoliosis, which I do not know anything here. Okay, you can stand up. Do you have any pain or tenderness while you do that? No? Okay. So then, next I want you to bend your knees up, just one at a time. Okay, and then bend the other one up. Okay, and that all looks good. So, next I want you to, and then also while I'm doing this, I can observe his gait, which he doesn't have any problem with his gait. He's standing up straight and normally. And next I'll have you sit down, and I will look for, actually I'll have you lay down. Okay, so next I'm going to check for his different reflexes. So the first one I'm going to do is the bar. So this is moving on to the neurological assessment, but I'm going to check his Babinski reflex on his foot. I'm just going to do that. Yep. And their foot should go up and straight, and that's the normal reflex. And then next I'm going to assess his Achilles tendon reflex. Okay, and then next I want you to sit up on the couch. And I'm going to assess his reflex in his knee. Okay, and that one is strong. And then I will assess for the brachioradialis reflex. It's on his arm here. Okay. And so next I'm going to look for, so I want you to, I'm going to stick out my finger. This is the finger to nose test. And you're going to touch my finger and then go back and touch your nose.
With my finger?
Yeah, with your finger. Do it again. Okay, do it over here. And then do it over here. Okay. Good job. And with these assessments, we're just seeing if they can follow our commandments and see if they can do it in a smooth motion to make sure their neuro is all intact. And then next I want you to, the rapid alternating movement, so I'm going to have you tap on your knees and then tap on the back of your, so tap with your palms down and then tap with your back of your hands on your knees. Keep doing it. Okay, And so he's doing that in a smooth motion and not having any trouble with that, so that's all intact. And then next I'm going to look for, I'll do the finger test where I can assess for the sensation of his finger. So give me your hand. I want you to close your eyes. I'm going to touch your finger and you'll just tell me where I'm touching it at.
Touching it in the middle of my finger.
Okay.
Which one? Closer to my fingertip.
And what finger am I touching now?
You're touching my thumb.
Okay. Alright, so he can tell what I'm doing with his eyes closed. And then next, I will have you close your eyes again, and I'm going to assess for the sensation on his face to see if he can feel me touching, and I've picked a cotton ball to use.
Touching on my right cheekbone.
Okay.
My forehead. On my right arm.
Okay, so he can feel, with his eyes closed, he can feel where the cotton ball is. I touched his forehead and his cheek and his arm. And then the last thing that I'm going to have you do is stand up and this I'm going to have you perform, it's called the Romberg test. And what I want you to do is, actually I have one more thing after this, but I want you to close your eyes, and then as he's standing here, he's not having any trouble with his balance with his eyes closed. The next thing I want you to do is raise one of your legs up and balance for just a second. Okay, and then do the next one. Alright, and so he did good with that. And then the last thing I want you to do is, I'll move this down so you can see the shins. I want you to keep your eyes closed, and then I want you to pick your right foot up and touch your left shin. Okay, and then do it with the opposite side. Alright, and this was assessing the heel down opposite shin, just to make sure that the neuro is all intact there. And this concludes my assessment for the musculoskeletal and neurological exam.